usually it's great because we get to meet new doctors, new friends,
to connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
Usually it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
We have a live broadcast, but we're not going to show you faces. It's going to be only for the presenters. Yes, so just you've been informed.
Okay, bonjour. My name is Katarzyna Nidzińska. I'm an aesthetic medicine specialist and ophthalmologist.
My name is Magda Fuss. I'm head trainer of Pureless. And together we will present you our Exosome Revital system line.
Finalist of IMCAS Industry Innovation Award 226.
Yes. But before that, we will tell you a little bit about our brand. I know that many of you just met them yesterday or 2 days ago, so maybe you don't know exactly what it's about. So, short intro about us. Okay, so as thank you. Already you are impressed. So as you have seen, we are a professional brand for beauty salons and clinics, and we also produce the product for home care to sell the clients after treatments. What is the more important about us, the French innovation? We are rooted in French heritage, but we are producing our product not only in France, but also in Spain and Korea, because we are a global brand. And we are always looking for something the best. So we cooperate with laboratories who are the best in producing some kind of chemical pills or some kind of mask. And then we want to have the best solution to create our lines, our products. So yes, as I say, global brand. Of course, all our products has a very strict UE standards. And also one last thing about our brand, which is, in my opinion, very interesting, is this code. Because as you can see, all our product has a number as a name for the product. And when the clients came to the clinic, the professionalist, the doctor, can create the treatment, because we don't have a strict protocol that you have to use this pill and this mask for the end. We try to believe in our professionalists to create the best solution for the clients. So they choose the best pill, the best, of course, we have some recommendation to use, but when they choose the best therapy, they can write it down as a code, and we call it individual beauty code for the clients. And also as a prescription to home care, they can write down the numbers, and this code, beauty code for the clients to use in home. Yes, and now
my turn
about
Exosomes. So Exosomes, as you know, it's a hot topic, one of the most frequently discussed issues in the field of cosmetology, dermatology, trichology, and aesthetic medicine. Thanks to the scientific reports, we are learning more and more about it. About these nanoparticles that are changing the face of regenerative medicine. Exosomes are the best mediators. Small spherical membrane nanovesicles with a diameter about 150 nanometers secreted by different cell types into extracellular space. Their primary function is to participate in cell-to-cell communication, both long or short distances, with the participation of a variety of body fluids. As you can see, they are the smallest type of extracellular vesicles that I said about diameter 150 nanometers. It is less than virus or liposome, so they are good communicators, fast and can deep penetrate all layers of the skin. Okay, so what they do? They affect all layers of the skin, affecting many processes of its reconstruction and strengthening. First of all, they stimulate the regeneration of the skin epidermal barrier by stimulating production of ceramides. Next one, they stimulate the production of collagen and elastin, so they are really good factors of anti-aging. And also they reduce inflammation processes, so they affect the levels of cytokines that are responsible for the burning sensation, itching, or atopic dermatitis. I also use it at the alopecia therapy because they stimulate the follicles of hair. Okay, so why plant-derived exosomes? As you know, exosomes are best obtained from stem cell-rich sources, and equally to adipose tissue cells that are unfortunately banned for use in cosmetics in Europe. So its similar rich source of exosomes are the cells of plant called Xanthella asiatica, and it's most similar to those of human origin. They are stable, biocompatible, non-immunogenic, non-toxic, and what's more, obtained in large quantities. Xanthella asiatica is the best example of exosomes used in cosmetic, anti-inflammatory properties and stimulation, the regeneration and anti-genic, anti-aging processes. We have also evidence-based medicine approval thanks to advanced technology that exosomes concentration in raw material is approximately 1 million to 1 trillion particles in 1 milliliter. So a lot. Not only the quantities, but also the size of exosomes we measured. Most of them were around 100 nanometers, as you can see. That means the conditions for effectiveness of exosomes. What's more, we also have a data that shows that Xanthella is a good antioxidant that prevents anti-aging because of high concentration of polyphenols. Xanthella significantly inhibited tyrosinase activity and reduces intracellular melanin content, which means that it works with hyperpigmentation skin problem. As you can see, we measured also visible improvement of UVB-induced skin damage. Treatment 1 shows the Xanthella asiatica exosomes gel applied daily to the skin after the UVB. And second one is the exosome gel with additional extract of Xanthella. I think the results are really good after 6 days. Apart from the Xanthella asiatica in poreless exosomes Revital system, it contains also one more plant-derived exosome from Momordica harantia, which also is anti-inflammatory reactions, regenerative processes, anti-aging, but additionally, thanks to the content of prebiotics, it supports the microbiological barrier of the skin. Okay, wound healing properties in vitro, as you can see, fibroblasts treated with only 0.01% of the complex increased cell migration and close the scratch faster than controlled fibroblast. After 48 hours, the complex reached 100% wound closure.
Yes, so Naomi, something about our solution. So our set Exosome Revital system. Thank you. So this one. Inside the set we have a treatment, of course with exosomes. We have a free treatment inside and we have steps one by one. First, the peel, then we have a mesococktail, sterilized to microneedling. Also we have a hydrogel mask shaped for eye area and facial cream as the last step. This one cause due to contain of exosomes is regenerative, of course, but also has the anti-aging properties. So it can be a classic anti-aging treatment for eye area, but not only. So I will be tell about it a little bit later. Instead of the set, we have inside the line this Exosome Revital system because the whole line was nominated to the IMCAS award. We have also the facial cream and the facial mask as I said before, extension of the line. First product, the peel, Exosome Revital peel, Glow Eye Revital peel. There is a 5 milliliters of peel. It's important because it's enough to use also for the whole face. So if you want to extend the treatment, not only focus on eye area, we can do it with the peel. This one is water alcoholic, so we apply it with layers. After application layer, we can apply it really close to the eye, so even on the upper eyelid, really close to the lashes. So because of the content. As you can see inside, we have a base of this peel is ferulic acid, 8% of ferulic. So we have a brightening property, strong antioxidant one, fluoretine, which helps ferulic acid penetrate deeper, moisturizing lactic acid, but also mix of other fruit acid like malic acid and citric acid. Additionally, retinol palmitate. So we have anti-aging properties, antioxidant, also strong brightening properties. Also, what is interesting about the peel, as I said, it's quite gentle. It doesn't give the exfoliation effect. So there is no side effect, then the client will be exfoliate with the skin, which is good, and also it doesn't cause irritation. So we can easily go with microneedling after the peel. So it is great preparation, remove excess of the dead cells from the epidermis, but in the same time has a nice brightening results. And second product inside the set is Meso Cocktail. So Meso Cocktail is sterile, so we can use it with microneedling, or if it's not necessary, you can just massage it, use some ultrasounds to stimulate the penetration, or microcurrents. It can be used for radio frequency, so many kind of devices, including devices, we can combine this Meso Cocktail. Inside this one, we have this Centellia asiatica exosomes. So as Dr. before said, what is the main goal to use them inside the cosmetics? But additionally, we have here very interesting and popular now active ingredients. So this sodium DNA is the same active ingredient like a PDRN used in cosmetics. Additionally, we have a DNA, RNA support the regeneration, moisturizing active ingredients, to plant extract, dipantenol, so we have this calming, anti-inflammatory property, especially if we use it with more aggressive devices, it will helpful with anti-inflammatory action. So the second step, our Exofusion Meso Cocktail help with these anti-aging properties. And third step, so our mask. It's especially shaped, it's hydrogel, but especially shaped for our area with a small piece to apply on eyelid, because we can also microneedling on the eyelid area, and we have a special like a description and protocols video which can be helpful for the professionals to perform the treatment. After this microneedling, we apply the mask on the eye area. Inside we have typical anti-aging active ingredients. There is very interesting Osilift from oats, which create the layer on the skin which give nice tension, so the clients can see the results immediately after the treatment. Also, you saw there is a peptides, so stimulate the regeneration, but what's more, the mask is transparent. So because of this hydrogel, the light can penetrate through it, so we can use it with the LED light, for example. So also we can combine it with many devices which are already inside the clinic. And the last step from this coffret is a professional eye cream. So this one also is the home care cream, so it's the same formula, but of course packed in the bigger package. So for me it's great opportunity to show the clients that check the consistency, the nice smell of the cream, which is also important for the clients. So it's like a tester, but during the treatment, so the clients can check if there is some allergic reaction. So it's also a nice opportunity for the doctors to sell this product exactly after the treatment, because the clients know it already and it's not disregarded, oh, I have to check it in home. You check it just a minute ago, so you can decide right now. Inside the cream is also exosomes, of course, but inside the cream there is this Momordica carantia exosomes, but also a lot of great active ingredients which helps rebuild the skin structure, the hydrolipid barrier after invasive. For example, kombucha. So this is active ingredients full of prebiotics which help to rebuild the microbiota of the skin, but also anti-aging matrixyl, also ceramides which help to rebuild the hydrolipid barrier, and vitamins. Additionally, so we have a set for eye area, but we can add more if we decided to extend the version of the treatment for a full face. Peel is enough, mesococktail is enough to use it for a whole face, but of course mask we have only for eye area. So if we have a client like a young with first sign of aging, when the eye area, we have first wrinkles around the eye area, we can use just a set. If we want to extend this treatment for the rest of the face, we can use also the mask and face cream, so we have extended treatment. So it's the next option. But of course, it's available separately. So if we don't want to use the eye set, we can use just the facial product to use after lasers, after more invasive mesotherapy, so more invasive treatment, just the mask and the facial cream. It's separately packed, so it's the safest way to apply after invasive when we have this wound and we don't want to use something opened many times. So definitely hydrogel is the best option. Inside the mask, we have of course exosomes from Centella asiatica and anti-aging arginine, moisturizing substance, trehalose, coenzyme Q10, also betulin, allantoin, which help to calm down the skin after invasive. What's also important is divided on two, so we have an upper part and lower part. It helps to, we have many faces, many shapes of faces, so it helps to fit this mask better to the face. And also, because it's hydrogel, so transparent mask, we also can combine it with LED, with inside the beauty salon or clinic. And last product, we have a cream facial one. This one is also available as a home care, this 182. And facial cream, of course, contains exosomes from Momordica carantia. So we have a combination of two exosome, arginine, moisturizing, and also these active ingredients which can help rebuild the hydrolipid barrier and the skin after invasive. As I said before, this mask, the cream are available separately, so if some clients need just the cream after invasive, it's available. It's not necessary to buy the whole set and coffret. Treatment protocol. I will show you a short video of that. I skipped the part with makeup removal and preparation for the treatment, so we will start with peel. Maybe. As I said before, this is water alcoholic, so we apply it with layers. First thin layer. We can massage this layer in the meantime. Because of ferulic acid, it can be crystallized a little bit. You can see the white layer of the ferulic, so I recommend to remove it. Usually there is no need to remove ferulic acid, but in this case, before microneedling, I prefer to do it. So antiseptic before microneedling and microneedling with mesococktail. And the doctor can use any device as they have inside the clinic, so there is no need to use a special device. And also, as you can see, we also cover the upper eyelid, lower eyelid. The formulation of mesococktail is really good because it's not very liquid, so it's not flow down from the face. It's like a hyaluronic acid base, so nice sliding. And hydrogel mask. And here we have this extended treatment, so we can also add separately masked for face. And after 15 minutes we can just remove it and massage the residues of the serum from the mask. And the last step, so eye cream. And face cream. And as I said before, with these two products, so eye cream and face cream, we have also in home care version. But soon we will launch in also the serum from this line, so it will be also only available in a home care line. I'm not sure if maybe it's a secret about this serum. So
Mysterious product.
so don't tell anyone.
Okay, no.
That's a secret.
Only you, South America, will know it.
So at the end of my part, I would like to also tell you a little bit more about this award, because as you know, we were nominated, we are top 10 of IMCAS award with this Exosome Revital system line, and we try to address this line to few problems. First of all, because of delicate area of eye area, it's a periorbital region, because it's extremely thin skin, very delicate, of course, maybe not so tolerant for aggressive procedures. So it's good to add something calming down, anti-inflammatory, to stimulate the regeneration of this region. Also, yes, generally there is also this problem that many treatment solutions are rigid and one size fits all. So it's there is no so many options for personalization. We have, as you can see, many of them. You can use some devices, you can use single product, extended version, short version with home care, like many options, and also all of these options give the great results, as you will see soon. Yes, it's about also this post-procedural support, this home care, take care about the whole therapy, whole system. We are not giving you just one single
Product. It's
element.
holistic.
Yes, it's holistic, exactly.
Yes.
This word is really good to use here.
Okay. And so now I want to tell you and show my work and effects of the Exosome Revital system in aesthetic medicine. I use, as Magda said, the basic version of the treatment was especially for microneedling or just topical use. I extended it to more invasive version that I use in my work. So I recommend to combine the Exosome Revital system also after the injections like biostimulators or fillers. Also, I love it after the lasers, CO2 laser, TU laser, Pico. Also with PRP, it's fantastic. Usually after the laser or other treatment, I apply a gel mask and facial cream for faster recovery and to boost the effect of my work. What's more, patients use the cream for face or eyes twice a day per month as home care protocol. Okay, I will show you some of my case study results. So now I have a patient that shows the effect after one treatment using Tulum laser and, as I said, Exocom hydrogel mask and fusion face cream. Home care, it was just the Exofusion face cream twice a day per month. Okay, after one treatment, we will see evident reduction of post-inflammatory redness. And it's just after only one treatment. Okay, these results shows after one treatment using Tulum laser, also hydrogel mask and Exofusion face cream. So look at the redness of the nasal area. It was the problem of my patient. Due to exosomes and its anti-inflammatory action, we reduced the redness. And it is also proven by data from the LumiScan Pro that the redness level is lower, about 50%. So after one treatment, I think that's really a good result. Now I used PRP for eye area and Exosome eye set. Home care, it was Exofusion eye cream. Okay, visible periorbital rejuvenation and reduction of dark circles after one treatment. Now I will show you my patient after CO2 laser, botulinum toxin to the upper face that I used, and nanotrans fat and Exosome Revital system. Okay, visible reduction of wrinkles on the forehead, as you can see. We smoothened the skin and also under the eyes. Visible results. Here will be my patient after the polynucleotides and Tulum laser, of course with Exosome Revital system to the periorbital area, and there is the improvement of the upper eyelid area tension and improvement of color of the skin. You can see especially at the inner canthus. Okay, now I will show you the results after Tulum laser, botulinum toxin at the upper face also, and combined with Exosome Revital system. Okay, we have clearly reduction the depth of wrinkles about 24%. Okay, and as you can see, we reduce the depth of wrinkles between the eyebrows also. Okay, now effects after microneedling and Exosome eye set. so look at the redness. One more also reduction of wrinkles, and the reconvalescence with exosomes is really fast, as you can see. It's 1 day after the treatment, no edema, no redness, but the effects are really good. Okay, one more good results of the wrinkles around the eyes, and brightness and tightening of the skin at the periorbital. Now, also after microneedling with hydrogel mask and exofusion face cream at the end. So look how forehand presents. Skin is more smooth, the depth of wrinkles we also reduced. And under the eyes. And we have reduction of redness and also evidence-based pores reduction. Okay, so do you have some questions?
Yeah.
Yes.
This set is for clinical use only, or for home?
Yeah, it is only for clinical use, but you can take home home care products like face cream or eye cream. Yeah.
Okay.
Yes, the set mask and this 44 cream is only for professional.
Okay, and you use it with laser?
Yes.
And microneedles? Or
Yes.
only laser?
No, laser, microneedles, PRP,
Okay.
biostimulators, after the fillers, everything.
Okay.
Everything that is invasive makes bruises, redness, itching,
Okay.
for the faster recovery.
Yeah, exactly.
Okay. Great. Congratulations.
Thank you.
Thank you.
Maybe more question?
Not now.
Not
Well, we will need a presentation to share with our teammates. So you already have my card to share it. For now, that's all.
Great. So for the very end, at the very end, we have a short surprise for you. The quiz question, but only for present here, because we have
Online.
Yes. So short question. You have one chance to win something very amazing. So the question is, how many treatments can you perform with the set? Olympia.
I understood one.
3.
Very good. We have a winner. So you won our set.
Thank you.
So you can use the vial, but not all the vial at the same treatment. You can use 3 treatments.
Like for 3 clients or one client,
3
like
clients, okay.
every 2 weeks.
Okay. And how many treatments do you recommend to see better results?
3, also always
Yeah.
3.
Okay.
One per month.
But as you saw, even one treatment and you
Is
can
good,
show
yes,
the
but
result.
3 is the best results.
Okay.
It also depends on what kind of treatment, if you combine it with laser or just with microneedling.
What kind of problem?
Once per month.
Yes.
It depends on what with combination, because if you combine it just with microneedling, 2 weeks is enough to have a break. But with laser,
with
1
laser,
month.
1 month, like
Yes, so
4 to 6
yes, with this
weeks.
more invasive, of course, longer.
Okay.
If you apply it just topical, without any additional in-clinic devices, you can every week perform it.
Okay. Okay, great.
So thank you very much.
Thank
If
you.
you have any additional questions,
Very good presentation.
Thanks.
thank you.
Zrobimy zdjęcia jeszcze dodajmy. Dziewczyny, jeszcze nie uciekajcie, zdjęcie zrobimy.
usually like it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
Usually, like it's great because we get to meet new doctors, new friends.
Connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually like it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
like it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually like it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
Usually, like it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually like it's great because we get to meet new
colleagues and to stay up to date with all the innovation.
Advanced.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous
usually like it's great because we get to meet new doctors, new friends.
And to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
Sit down.
That's okay, we can start.
Okay. Good afternoon, everyone. It is a pleasure to be here with you, discussing some important and new update about aesthetic.
Firstly, nowadays, it is the time for combination therapy. Previously, all the therapies was solo, just one technique. Nowadays, we combine a lot of procedure in the same session. We do RF, then inject PRP. We do a peel and give the patient home treatment. We do filler with biostimulator. We do resurfacing CO2 and inject exosome. Like purely give us this combination to achieve good results and to have less side effect and also to have less number of sessions by Exosome Revital innovation. Starting with the Revital system of Exosome, Purely is a professional French and European brand. They combine natural ingredient and give us a full range of skincare that help us and solve most of the skin problem. A full range of brands and give number codes for each one, ranging from home treatment and inside the clinic sessions. So we have combination of inside the clinic session and home care treatment, which is based on boosting the effect and the result of the session that done in the clinic. About the brand. As mentioned, the Purely, the French innovation laboratories for synthetic natural ingredient give us full range of solving most of the problem of skin conditions. Starting with, as you know, Exosome, and it is in the last few years, Exosome is the trend product for solving most of the skin problems. As you know, the Exosome is the tiny extracellular vesicles surrounded by lipid layer, and they give message to the surrounding cells derived from original cells, including protein, lipid, growth factors, messenger mRNA, and DNA. As this diagram shows, the exosome, it is the smallest type of extracellular vesicles. Even sometimes it is less than viruses. In aesthetic medicine and cosmetology, the exosome have a crucial component in supporting the skin regeneration and fighting all the signs of aging, stimulating collagen, elastin, and significant role in regulating inflammatory processes and angiogenesis. It also have the ability to penetrate the skin barrier, allow for the effective delivery of active ingredient into the skin. The exosome is divided into natural and synthetic sources. The natural may be human, may be animal, and plant. Here in Purely, they use plant-derived exosomes. The plant-derived exosome is similar to animal source, also contain DNA, RNA, proteins, lipid, and showing various physiological activities. The plant-derived exosome are stable, non-toxic, non-immunogenic, cholesterol-free, and obtainable in large quantities. And this, the source of this plant is Centella asiatica exosome. This source of exosome have combined regenerative properties and anti-inflammatory agent, and also give improving skin firmness, elasticity, reduce inflammation, repairing processes. They also have strong anti-inflammatory properties. They soothing the redness and irritation. The Centella asiatica exosome, it's measured in nanoparticle tracking analysis that used to determine the number of exosome particles. It have the largest concentration of exosome per 1 ml. This diagram shows that Centella asiatica exosome have small size vesicles and large amount of concentration per 1 ml may reach 853 million per 1 ml. Centella asiatica exosome also contain high level of polyphenol that act as anti-oxidative stress that significantly reduce the intracellular reactive oxygen species that contribute to skin aging and UV damage. At this diagram show comparing between the control, when we have Centella asiatica exosome, especially the smallest vesicles, they have the higher scavenging assay for reactive oxygen species. Also, they significantly inhibit tyrosinase activity by intracellular melanin content and intercellular tyrosinase activity, and comparing to control or arbutin, small size vesicles of Centella asiatica exosome give us the high of decreasing the intracellular tyrosinase activity. Also, this diagram show how it is help and boost for healing processes. This show the UVB induced skin damage treated with Centella asiatica exosomes. After the 6 days, we have healthier and more uniform appearance compared to this one untreated UVB exposed skin. Another source of another plant of used by Purelay is exosome of Momordica carantia. Exosome here form a transport system, also have regenerative processes and reducing inflammation, acting as anti-inflammatory. The other distinguished thing is they have the prebiotic. It supports the microbiological balance of the skin and stimulating collagen production, which lead to improved elasticity and firmness. In this diagram, we see there is a wound here, and this combined treated with exosome. So we have after 48 hours with this fixed and stained with this stain, we see here it will be mostly it is closed. So it have very anti-inflammatory effect. Starting with the kit of Exosome Revital system to Dr. Jessica.
Thank you. اوكي انا رح احكي بالعربي. مثل ما كان عم يحكي دكتور محمد، الاكزوزومز اللي عم يستعملوا ببيرلي هن بلان ديرايفد. ليه نقينا بلان ديرايفد؟ لانه البلان ديرايفد اكزوزومز بنقدر ناخذهم بكميات كثير كبيره. بلس من السانتيلا ازياتيكا هن اكثر اكزوزومز بيشبهوا الهيومن اكزوزومز، بس بنفس الوقت هن بلان ديرايفد. مثل ما كلنا بنعرف بيرلي اكزوزوم ريفايتل سيستم هيدا السنه طلع توب 10 ب IMCAS Innovation Awards. ليش؟ لأنه في كتير براندز عملوا اكزوزومز، however هدول الاكزوزومز هن simply exosomes that are injectable. وقت نحكي ببيرلي عملوا سيستم كامل، وكان أكتر التارجت تبعهم very tricky area اللي هي منطقة حوالي العيون، اللي هي منطقة رقيقة ما فينا نكون عم نشتغل فيها حيالله شيء. رح نكون عم نشوف إنه بالاكزوزومز تبع بيرلي رح نكون أكتر مركزين على هيدي المنطقة اللي بلشنا فيها تقريبا من سنة لورا، وهلا بلشنا نشتغل باكزوزومز أكتر كمان على الفيس. اول ما بلشت الكت كانت كت فيها اكثر اكزوزومز للعيون، هلا قادرين نكون عم نشتغل على كل الوجه. شو بتتضمن ريفايتل بيل. نحن قادرين نكون عم نعمل بيلينج مخصص للعيون، وهلا رح نكون عم نشوف شو هن الانجريدينتس اللي موجودين فيه. عندنا الاكزوفيوجن ميزو كوكتيل مينلي بنشتغلوا بطريقه المايكرو نيدلينج تناخذ بيتر ريزلتس. ومثل ما كلنا بنعرف هلا في كتير ديبيت على موضوع الاكزوزومز اذا بنعملهم انجكتبل ولا بنعملهم وذ مايكرو نيدلينج. هاويفر شفنا بالستاديز انه وقت نعمل الاكزوزومز بالمايكرو نيدلينج عم نقدر ناخد ريجنريتيف ايفكت احسن وانتي ايجينج ايفكت احسن من انه نحن نكون عم نعملهم انجكتبل. سو هذا الشيء بيرجع لكل طبيب شو بيحب يكون عم يعمل، شو الطريقه اللي بيحب يكون عم يشتغل فيها الاكزوزوم. تنكون عم نبلش شوي نفوت بالانجريدينتس. مثل ما قلنا من بعد ما انعمل الاكزوزوم ريفايتال سيستم فور ذا ايز، زادوا عليه هيدي السنه الاكزوزوم ريفايتال سيستم فيس كريم، وزدنا عليه كمان الهيدروجel ماسك. الهيدروجel ماسك كثير حلو خاصه من بقلب الكلينيك من بعد ما نكون عاملين ريسيرفيسنج بروسيجرز مثل فراكشنال CO2 مثل ما شفنا بالسلايدز اللي قبل. in 48 hours الووند هيلينج بروسس كان كتير احسن when we used exosomes من وقت نكون عم نستعمل حيلا بلانك جل او حيلا calming solution. فيرست رح نكون عم نحكي عن الريفايتال بيل، جلو اي ريفايتال بيل. اللي حلو بهذا البيل انه هو فيه كومبينيشن لكذا نوع من الاسيد، بس بنفس الوقت كلهم they are very safe لمنطقه حوالي العيون اللي هي كتير تريكي وكتير رقيقه. مش بس بنشتغلها للدارك سيركلز، نحن قادرين نشتغلها على الابر ايلid وقادرين نشتغلها على اللور ايلid بنفس الوقت. مش بحاجه انه نكون عم نعمل لها نيوتراليزيشن لانه هيدا ووتر الكحوليك بيل، فنحن كل ما نعمل لاير ورا لاير بنكون عم نقدر نقوي الايفكت تبع البيل اكثر. بس نحط وقت نكون عم نحكي عن ووتر الكحوليك بيل بس نكون عم نحط اول لاير الالكحول وقت يطير خلص الايفكت تبع البيلينج. سو انا قوي بدي اكون عم بستعمل اعمل لايرنج بلس بدنا نكون عم ننتبه على موضوع انه هيدا البيل نقدر نكون عم نستعمله كل السنه مش بس بفصل الشتاء. سو اتس سيف انه نستعمله حتى بالصيف. شو هن الاكتيف انجريدينتس اللي فيه؟ اول شيء عندنا الفيروليك اسيد. مثل ما بنعرف الفيروليك اسيد عاده بنستعمله مع الفيتامين سي ان اوردر انه نكون عم نقوي الانتي اوكسيدنت ايفكت تبع الفيتامين سي. سو الفيروليك اسيد موجود بالبيل تيكون عم بيساعدنا نعمل انهانسمنت لاذر انتي اوكسيدنتس موجودين بالبيل وبالميزو كوكتيل. ثاني انجريدينت اللي هو الفلوريتين. بنعرف اكثر المشاكل اللي بنعاني منها منطقه حوالي العيون هي الهالات السوداء. سو نحن بحاجه لشيء يكون عم بيساعدنا على البيجمنت كنترول. البيجمنت كنترول رح يكون عم ينشغل اول شيء ثرو الفلوريتين. اللاكتيك اسيد موجود كرمال يكون عم يعطينا ترطيب من بعد هيدا البيل. سو هيدا البيل منه انفيزيف، ما رح نكون عم نشوفه عم يقشر، هاويفر رح نكون عم ناخد كيراتوليتيك ايفكت بدون ما نكون عندنا تقشير ونشف. رابع انجريدينت موجود معنا هو الماليك اسيد. الماليك اسيد بيساعدنا انه نكون عم نحسن تكستشر منطقه حوالي العيون. تكستشر منطقه حوالي العيون يوجوالي بنشوف عند كثير اشخاص لانه هي اريا ما بيعملوا لها اكسفوليشن بالبيت يوجوالي العالم، فبنلاقي انه عندنا فيها كثير مشاكل مثلا مثل الميليا، مثل انه وقت يكونوا عم بيحطوا الكريمز بالبيت بيكونوا ما عم ياخذوا الابزوربشن المفروض يكونوا عم ياخذوها. سو بنجي بالماليك اسيد بنقدر نكون عم نساعد انه نكون عم نملسها اكثر. ستريك اسيد موجود تيعملنا بي اتش ريجوليشن بما انه نحن ما رح نعمل نيوتراليزيشن من بعد البيل. واخر شيء اكيد الريتينيل بالميتيت اللي حيكون عم يعمل لي سيلر تيرن اوفر عالي. ثاني انجريدينت رح يكون موجود معنا بقلب الكيت او ثاني برودكت هو الميزو كوكتيل. الميزو كوكتيل مثل ما قلنا بنقدر نكون عم نستعمله بطريقه توبيكال. اتس بيتر انه نكون عم نستعمله بالمايكرو نيدلينج. هاويفر وقت نكون عم نعمل فينا كمان نكون عم نعمل انجكشن. شو هن الانجريدينتس اللي فيه؟ عندنا مثل ما قلنا سانتيلا ازياتيكا. السانتيلا ازياتيكا موجوده كاكستراكت وكاكزوزومز. سو مينلي بالبروفيشنال لاين رح نكون عم نشوف اكثر سانتيلا ازياتيكا اكزوزومز. وما رح ارجع عيد شو حكي دكتور محمد عن اهميه ليش اخترنا السانتيلا ازياتيكا اكزوزومز. انا قادرين نكون عم ناخذ كميه كثير كبيره 853 مليون اكزوزوم بنلاقيهم ب 1 مليلتر. ثاني انجريدينت موجود معنا هو الهيدرولايز دي ان اي اند ار ان اي. مثل ما كلنا بنعرف هلا اغلبيه الدكتورز بعياداتهم they are injecting polynucleotides. سو هون كمان نحن نشتغل على ريجنريشن، ونكون عم نسمك شوي الجلدة بمنطقة حوالي العين. صوديوم دي ان اي، عم نحكي بي دي ار ان، روزا سانتيفوليا اكستراكت، والبانتينول والصوديوم ياليرونيت، كلهم بيساعدونا انه نكون عم نعمل سموذنج للاريا ونكون عم نخفف الفاين رينكلز اللي موجودين. واني هلا رح نكون عم نشوف باخر البرزنتيشن سلايدز عم يفرجونا بيفور اند افتر immediate results كيف تعبوا عنا الرينكلز. ثالث ايتم بنلاقيه هو الجلو اي هيدروجيل ماسك. فنحن من بعد ما بنعمل البيلينج ونرجع نكون عم نعمل المايكرو نيدلينج، رح نكون عم نحط الماسك لنكون عم نروق البشره. كمان هيدا فيه اكزوزوم وفيه كومبلكس كثير بحب احكي عنه اللي هو الايلس كومبلكس. الايلس كومبلكس موجود بهذا الماسك، كمان رح نشوفه بالكريم اللي بنعطيه للبيشنت على البيت من بعد السيشن، لانه بيساعدني تو ريديوس ذا بافينس بمنطقه حوالي العيون. سو ات ويل ريديوس ذا اديما حوالي العيون. الاكزوفيوجن اي كريم اللي موجود بالبروفيشنال لاين، في عندنا مثله هوم كير بيكون عم ينعطى للبيشنت تتكون عم بتكمل التريتمنت بالبيت. وهون بهمني فسر شغله كثير مهمه، هيدا شيء من الاشياء اللي خلى بيرلي ريفايتل اكزوزوم ريفايتل سيستم يوصل للتوب 10 بإمكاس انوفيشن اندستري، لانه عم يعطي حل كامل، مش انه نحن عم نعمل لهالبيشنت اكزوزومز ونبعتها على البيت. نحن عم نشتغل بالكلينيك بروفيشنال وعم نرجع نبعتها عندها نفس الجام قادره تكون عم بتكمل فيها بالبيت، كرمال تكون مثل ما على طول بنقول انه بالكلينيك البروسيجرز they are complementary, they boost effect تبع الكريمز بالبيت والعكس صحيح. الكي اكتيف انجريدينت بهيدا هو الممرديكا كارانتيا اكزوزوم، كمان حكى عنها دكتور محمد. سو هيدا ثاني نوع من البلانتس اللي بنستخرج منه اكزوزوم اللي هو الممرديكا كارانتيا. سو البروفيشنال لاين بنشتغل فيها السانتيلا ازياتيكا، اما باللاين اللي هي هوم كير او الكريمز بنلاقي الانجريدينتس الاكزوزومز they are derived من كارانتيا. الكمبوشكا بتساعد كمان على انه نكون عم نخفف عم نحافظ على الميكروبايوم تبع المنطقه اللي حوالي العيون. الماتريكسيل as a collagen stimulation peptide، مثل ما بنعرف كمان الماتريكسيل او اني collagen stimulating peptide بيشتغل as a botox like ingredient. سو للاشخاص، وهيدي كثير بنعاني منها وقت نكون عم نشتغل بوتوكس للبيشنتس خاصه بمنطقه حوالي العيون، بنشوف انه هيدي الاريا they are fine with it، بيرجعوا بيقولوا لنا بعد في عندي رينكلز تحت العين. هيدول الرينكلز بنقدر نكون عم نصيبهم وهيدا الشيء على طول مثل ما بنقول complementarity. ونحن هلا بايرا تحكي عن الهوليستيك ابروتش اللي هي الكومبينيشن بين كذا ثيرابي لنقدر نوصل ياخذ البيشنت ذا بيست ريزلت. الاكزوكالم هيدروجيل ماسك هيدا اديشن جديده هيدي السنه، مثل ما حكينا بيجي ماسك بنقدر نكون عم نستعمله بعد حيلا تريتمنت بالعياده انفيزيف، اذا عم نحكي عن مثل ما قلنا فراكشنال CO2 راديو مايكرو نيدلينج وذ راديو فريكونسي اتسترا. بيجي 2 بيسز ماسك بنحط على المنطقه الفوقانيه والمنطقه التحتانيه. الاكتيف انجريدينتس اللي فيه سانتيلا ازياتيكا اكزوزومز، ارجيريلين. الارجيريلين مثل ما بنعرف اللي هلا كمان كنا عم نحكي عن الماتريكسيل، هي نيورو ماسكولار موديوليتر، يعني ات اكتس لايك بوتوكس بس بطريقه لس بدون ما نكون عم ناخذ الفروزن افكت تبع البوتوكس، اكزاكتلي مثل المايكرو بوتوكس، واتس بلانت ديرايفد. التريالوز الكو انزيم كيو 10 نعرف هيدي قديش كان لها ترند اخر فتره، بتساعدنا بالميتوكوندريال انتي اوكسيديشن، والباقيين هن they are soothing and antioxidant ingredients. كمان انوفيشن تبع هيدي السنه هو الاكزوفيوجن فيس كريم. سو انا خلصت البروسيجر بالكلينيك، اعطيت البيشنت تكون حطيت للبيشنت الهيدروجيل ماسك، برجع بكون عم بقدر احط لها الفيس كريم وبكون عم ببعتها على البيت تيبلش الهيلينج افكت. ومثله رح نكون عم نلاقي بالهوم كير لاين اكزوزوم ريفايتل اكزوفيوجن فيس كريم. وهيدي السنه كمان اللي هلا الاخر ريليس يمكن اكيد شفتوه على البوث هو السيروم. سو الاشخاص اللي ما بيقدروا يكونوا عم يتحملوا الثيك تكستشر تبع الكريم، لانه الكريم بيجي شوي باتري التكستشر تبعيته، بنقدر نكون عم نعطيهم السيروم اللي بيجي شوي اخف بالتكستشر. الممردكه كارانتيا مثل ما قلنا عم نشوفها على طول بالهوم كير او بالكريمز. usually بالاكزوزومز، الاكزوزومز هو منه شيء جديد، الاكزوزوم هو شيء كتير كان موجود من قبل، وخاصة عند الكانسر patients هدول they receive a lot of exosomes etc. بس شغلة كتير مهمة انه هلا صرنا عم نسمع فيها اكثر كترند بالكوزميتولوجي وبالاستاتيك ميديسن وبالدرماتولوجي. شو الهدف منهم؟ عندهم كتير، الحلو بالاكزوزومز انه عندهم كتير قصص بيقدروا يكونوا عم بيساعدوا فيها السكين، بس نحن مينلي مركزين على موضوع الريجنريشن، لانه الريجنريتد سكين is a healthy skin. وهلا الترند هي having healthy skin. This is why هلا عم نشوف الاكزوزومز صاروا موجودين اكثر بالاستاتيك ميديسن تريتمنت. والحلو فيها انه نحن قادرين نكون عم نستعمل الاكزوزومز على all types of skin including sensitive skin. ما في حدا نحسس على exosomes، او ما في حدا نحس انه الجلد تبعه it can't tolerate the exosomes. So mainly نحن بشغلنا in dermatology and aesthetic medicine تركيزنا على regeneration، تركيزنا على الانتي ايجينج. however كمان بفتكر الاغلبيه عم يستعملوا الاكزوزومز for alopecia for hair loss. So قادرين نكون عم نستعملهم بكذا indication. التريتمنت بروتوكول رح نكون عم نشوفه شوي سوا لناخذ فكره كيف بيصير. هلا دكتور محمد اشتغلوا كمان انجكتبل it was very good. سو بالاول اكيد بدنا نكون عم نحضر السكن. بناخذ البيل بيجي فيه 5 ml. 5 ml is too much اذا بدنا بس نستعمله لمنطقه العيون. however نحن قادرين نكون عم نشتغل صرنا فيه على العيون وعلى الوجه كامل. هيدي طريقه الابليكيشن على منطقه العيون. بحب ذكر انه هو ووتر الكحوليك بيل. سو نحن اذا بنعمل كذا لاير بنكون عم نخليه يصير ناخذ منه better effect. ومش الوقت، نحن وقت نحكي بالبيلز على طول عنا يا الجل يا الووتر الكحوليك. وقت نحكي الجل نتركه وقت اكثر باخذ انا بيلينج افكت اكثر. وقت نكون عم نحكي ووتر الكحوليك بعمل لايرز اكثر باخذ افكت اكثر. ثاني ستيب بنكون عم ناخذ الميزو كوكتيل مثل ما قلنا وي كان انجكتد، بس better results were seen وقت نعمل له مايكرونيدلينج. هون ما عملنا نيوتراليزيشن للبيل، هون بس شلنا البيل. however انا بماي براكتس بخليه عاده وبرجع بشتغل فيه لانه it's very safe. مثل ما عم نشوف عم نشتغلها بالمايكرو نيدلينج، قادره اشتغل على اللور ايليد upper eyelid full face بطريقه كتير سيف. وحتى الاكزوزومز بنقدر نكون عم نستعمله as a prepping treatment any aesthetic procedure. So من بعد المايكرو نيدلينج usually مايكرو نيدلينج بنشتغله على 1 ملم up to 1.5 ماكسيموم بالوجه. اما بمنطقه حوالي العيون بنشتغل 0.25 up to 0.5 ملم. خلصنا نقدر نكون عم نحط الماسك مثل ما شفنا على منطقه العيون. برجع بذكر هيدا الماسك فيه الاكزوزومز من سانتيلا ازياتيكا. نيو ماسك اللي صرنا كمان نحطه على الفول فيس، واللي بنقدر نكون اذا ما بدنا نعمل كل التريتمنت تبع الاكزوزوم بنقدر نكون بالكلينيك مثل ما قلنا من بعد حيلا انفيزيف تريتمنت ليكون عم بيساعد بالووند هيلينج. بنرجع بنشيل الماسك ومساج البرودكت الباقي. بنحط الاكزوفيوجن كريم لمنطقه حوالي العيون، وبنرجع بنحط الكريم تبع الوجه. بحب ذكر الكريمز الاكزوزومز تبعهم منهم من سانتيلا ازياتيكا، الاكزوزومز تبعهم جايين من ممردكه كارانتيا. اوكي ومن بعدها هلا رح نكون عم نشوف بالهوم كير قادرين نفس الكريمز اللي حطيناهم نكون عم نعطيهم للبيشنت بالهوم كير. مثل ما قلنا اوريدي نحن اول ما بلشنا بالاكزوزومز بلشنا بالاكزوفيوجن اي كريم، رجع نزيد الفيس كريم، وهلا ذا نوفلتي بهيدي السنه هو السيروم للاشخاص اللي بيحبوا سيروم. ومش كتير في براندز بيعطوا عندهم اكزوزومز تنعطى على البيت، هيدي شغله كتير مهمه. اكزوزومز هو ترندنج بالنسبه لنا حتى بالنسبه للبيشنتس، وبنفس الوقت نحن قادرين نكون عم نعطيهم better results with creams يكونوا عم يستعملوهم بالبيت. اوكي رح نعمل شوي مثل ما قلنا الاكزوزومز they support the effect of any treatment نحن عم نكون عم نعمله بالبيت، حتى فينا نكون عم نعملها post injection. امبارح شفنا ليب فيلر، من بعد الليب فيلر نحط الاكزوزومز السويلنج كثير خف من بعد ما عملنا البروسيجر. اليوم بريسك ما في سويلنج. So it was very interesting. حتى مثلا اذا عملنا injections لبولينيكليوتايدز بمنطقه حوالي العيون حطينا من بعدها الاكزوزوم، قادرين نكون عم ناخذ better results، لانه usually بالانجكشنز بمناطق حوالي العيون البيشنتس بيعانوا من موضوع التنفخ والورم لفتره معينه in combination مع other treatments. شغله كثير مهمه قبل ما نبلش before and after، ارجع الميكرو لدكتور محمد، انه نحن وقت نكون عم نحكي عن ريزلتس ببيرلي، الريزلتس بطلوا صوره بيفور اند افتر معدل عليها يمكن بالفوتوشوب او وات ايفر. نحن قادرين نكون عم نشوف الريزلتس قدامنا بطريقه كوانتيتيف، يعني نحن through the skin analyzer لومي سكان برو باي بيرلي قادرين نشوف البيجمنتيشن خفت، قادرين نشوف انه هيدول الرينكلز خفوا، قادرين نشوف انه التكستشر صارت احسن، الكولاجين صار احسن.
objective rather than subjective.
exactly. يعني احنا قادرين نفرج البيشنت انت فعليا اخذت good results. هلا رح نشوف صوره نشغل فيها بالتوليوم ليزر، من بعدها نشغل بالاكزوزوم اي سيت، والبيشنت انعطت اكزوزوم اي كريم حتى نشغل على الوجه كامل، نقدر نكون عم نشوف الريزلتس بيفور اند افتر. حتى كان حكى دكتور محمد عن الانجيوجينيسيس ايفكت بالاكزوزومز، نقدر نشوف بوست انفلاماتوري هايبر بيجمنتيشن كثير خافه، والاريثيما كثير خافه، ومنطقه حوالي العيون صارت احسن. هيدي بمنطقه حوالي التم. اوكي، هون قادرين كمان نشوف البيجمنتيشن. هيدا وقت نشغل على الفول فيس نطلع بمنطقه حوالي العيون، بنشوف انه سمكه الجلد تعبت اكثر هيدي الاريا. وهون رح ياخذ عنا دكتور محمد تنكون عم نكمل نفرجي الباقي البيفور اند افترز.
We started the discussion about the combination therapy, which is nowadays it is not told the trend، يعني ما نسمي trend، بس انه بالجديد انه الكومبينيشن، انه نسوي كذا شغله بنفس السيشن. مثل هنا عندنا we have PRP for eye area and other tab would give him exosome eye set, as Dr. Jessica said, the peel and exosome and home care treatment. This is after one session. يعني نقدر نشوف انه the quality of skin is better, the wrinkles, even the hollow of the under eye is better than before. Also combination of CO2 ablative laser, fat or lipotransfer, and also with Exosome Revital system. In this case, we have severe static lines in the forehead, white pores, bad skin quality, undergo resurfacing CO2, and Exosome Revital system. Also, on the area surrounding the eye, we see improving the quality of the skin, the wrinkles, and also the hollowness under the eye. This is also a case, combination of injection of biostimulator and also laser and exosome of Revital system. This patient done Sculptra, polynucleotide, thallium laser, and also exosome. كانش جت شرجوها هاي البيشنت. سوري.
شاورت بي.
اي والله. لا شاورت بي الطبيب اللي سواها. Also improvement in the skin quality of the upper eyelid. We see it is more lifted, less excess skin, and less wrinkles. Combination of thallium laser and exosome Revital system after one session of a treatment. And this is core. We'll see.
هيدي تبع السكالترا. This one is.
اي لأننا بس مصورين المنطقة مال بس surrounding the eye. صح. I think this one is as Dr. said. Will be lifted skin, good skin quality, less wrinkles, even the parameters also by scale analysis. There is decrease in the wrinkles about 7 times when comparing between before and after. Very nice result. This is the same patient with the static frons lines. Will be improved after the exosome. It boosts the effect of other injectable materials. Also, it is the best in the clinics of the microneedling and exosome eye set. Also with home care of Purelay. This is immediately after the treatment with the little erythema, and one day after we see the exosome boosting the anti-inflammatory effect of the microneedling. Will be there is no erythema, less downtime, and good result regarding the depression here and also the lines of the wrinkles. This is a case of mild acanthosis here near the lower eyelid. Also it's improved immediately after treatment with exosome Revital system. Before and after also of microneedling with using exosome Revital system, improving the skin quality and decrease the wrinkles here. The same thing here, also before and after, with this nice result. Even sometimes after Botox injection, we have remnant number of wrinkles, especially in the lower eyelid. So with maybe after 2 weeks, we do exosome Revital session for improvement the remaining of the wrinkles here in this area. Also, this is a case with effect of one session of microneedling and this Revital system of the mask and the gel on the cream, and also home care treatment of Exofusion face cream. In this case, we see the forehead more shiny, more regenerative processes, less pigmentation. Also, the static line is less after one session of microneedling and the Revital system. The same here, also after one session of microneedling and the exosome Revital system, decreased number of white pores, more good skin quality also. Before pod orange of the white pores will be decreased. Any question? Thank you. Thank you, Doctor.
يعطيك العافية. كان لازم أعملكم كويز بس حتى نشوف إذا حفظتوا.
لا هي اسماء النباتات هاي.
يا عين عليك.
ولا
من اي اوريجين موجود الاكزوزوم بالبروفيشنال؟
Usually like it's because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovations.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually like it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovations.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually like it's great because we get to meet new doctors, new friends,
To connect with colleagues and to stay up to date with all the innovations.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually like it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually like it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually like it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovations.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło. We used to.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovations.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually like it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, it's one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
Usually, like it's great because we get to meet new doctors, new friends,
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually like it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
Usually, like it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually like it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
So good day and welcome everyone. We hope you had another day full of interesting insights and useful knowledge. Since you are here, we know that you are eager to know even more, which makes us very happy. My name is Joanna and today, together with Jessica, we're gonna guide you through today's presentation. What do you use to manage hyperpigmentation? Do you use anything?
Kojic.
All right. Well, today we're going to show you different solution, namely melanocontrol system by Purelay, the depigment reset. Why? Because hyperpigmentation is one of the most challenging concerns in aesthetic and dermatological practice. It requires more than a single product. It requires control, protocol-based approach. But before we look at the system itself, let's take a moment to briefly understand the expertise behind its development in the context of Purelay brand and discoloration. We are a global brand. We are deeply rooted in French heritage, but we collaborate with not only with the best laboratories in France, but also worldwide. We source ingredients and technologies from the places where their effectiveness is strongly proven. So, from France, the skincare, the cutting-edge chemical peels from Spain, the Korean innovations as well. All our products are developed in line with the strict European quality and safety standards. And of course, all of our products are dermatologically tested. We create our products that respond to real needs of the client's skin. And of course, we continuously expand Purelay portfolio, launching new products based on latest scientific discoveries. We believe every person is different, every skin is unique. That's why we design diversified treatment protocols and tailor-made home care routine. And of course, our treatments are very effective, and you can see the results straight after the first treatment. So to effectively prevent and manage hyperpigmentation, we must first understand where it originates and why the skin produces pigment at the first place. So this diagram does not show the beginning of the pigmentation. It shows the control center. So here in the epidermal melanin unit, the decisions are made that determine how much pigment will be produced, transferred, and actually visible on the surface of the skin. So at the first glance, this diagram looks like a comic book, right? Well, and that's exactly the point, because melanogenesis, it's another linear pathway. It's a very complex network. So at its center, we have microphthalmia-associated transcription factor, which integrates the signal from multiple pathways and regulate the key melanogenic enzymes like tyrosinase. This biological complexity helps explain why pigmentation disorders like melasma, it's chronic and recurrent, and why targeting just a single pathway is rarely sufficient. In pigmentation disorders, the appearance can be misleading. So the same brown spot can have completely different origin beneath the skin. Melanin can be located in the epidermis, dermis, or both. And this depth is the key factor influencing the treatment response. That's why epidermal discolorations often improve quickly, while the derma and mix, they require longer treatment and more cautious approach. So once we understand that depth matters, we can link it to this what we see on the surface of the skin. So the more superficial the pigment, the darker and more defined the discoloration appears. As melanin sits deeper, the color shifts and the treatment becomes more challenging. Visual assessment is just a starting point, but rarely sufficient. That's why in our diagnosis we use LumiScan Pro by PureLab, because it's a diagnostic device. So using UV light and different light sources, additional light sources, because there we have 3 more additional light sources, LumiScan allows us to assess pigmentation depth. So the epidermal pigmentation, the epidermal melanin appears more contrasted under UV light, while deeper pigmentation shows less enhancement. So this multi-analysis helps localize pigment precisely and guides the most effective treatment strategy. This picture is actually from our LumiScan Pro by PureLab. So you can see actually that it was done under the UV light. I'm going to go through just the most common hyperpigmentation, types of hyperpigmentation very briefly. So we start from the freckles or ephthalites. They are mainly genetic response to UV exposure. They are strongly associated with the variants of the melanocortin-1 receptor gene. So in these patients, melanocytes, they simply produce melanin after UV exposure. That's why freckles darken in the summer and fade in the winter. What's interesting is that freckles reflects a hypersensitive UV signaling pathway, not the permanent melanocyte activity. That's explained that using the SPF remains the most effective strategy. Lentigens are a completely different story. These lesions are considered as a chronic photoaging. So unlike freckles, lentigens persist because of long-term UV-induced changes in the epidermis. Recent research shows that solar lentigines, in the solar lentigines, keratinocytes play a key role by continuously releasing melanin-stimulating factors such as endothelin-1 and inflammatory cytokines. Post-inflammatory erythema, or PIE, it's another true pigmentation. It's a remnant of the inflammation. PIE reflects the network of dilated capillaries and hemoglobin, not the melanin, actually. So clinically, of course, it appears as a pink, red, or sometimes purple lesion, which turn pale when pressed. PIE more often are visible on the first skin, and in these patients, it's more difficult to work on that lesion. Of course, if these areas are exposed to UV radiation without SPF, they can evolve into post-inflammatory hyperpigmentation, so the second type of post-acne discoloration. So we deal with it in two situations. So as I said, when we leave the fresh discoloration without SPF and we're gonna go on the sun, then we can have the PIH. And secondly, in the case of darker complexion, it's very common for a fresh acne discoloration to be a pigmented discoloration right away. And the last but not the least, melasma. Very strong influenced by the female hormones, so we can see it in a pregnant woman, on oral contraceptives, but also men on estrogen therapy. Estrogen stimulates melanocytes. The estrogen stimulates the melanin production, actually, and melanocytes, they have estrogen receptors, which explains this sensitivity. Melasma isn't just a pigment problem. It involves multiple layers, multiple structure beneath the skin, especially the blood vessels, which contribute to its persistence. Of course, the UV light, even the blue light, make it worse. That's why diagnosis is mainly clinical. That's why we use the LumiScan Pro by Purelab, for example, which can help assess the pigment and guide the treatment. We all know UV is the main cause of a hyperpigmentation, but we already know that the blue light from the screen can contribute too. On top of that, hormones, certain medications, herbs can make the skin more sensitive. Any inflammations, any minor injuries can leave a lasting mark if the skin overreacts. Prevention is easier than cure. That's why the sunscreen should be the first step of the treatment in the hyperpigmentation. Peels works well for the surface pigments. But for example, stubborn melasma loves to hide deeper. That's why in that case, it's good to combine different kinds of treatment. So peels with lasers, peels with the microneedling, and of course add to that appropriate home care routine. What to do when the discoloration already appeared? Well, we use the melanocontrol system, which Jessica will now talk about.
Thank you, Joanna, for this lovely introduction, reminding us again about the definitions for hyperpigmentation, because hyperpigmentation is not the same, so it's not treated the same. Let's talk a little bit about melanocontrol. Melanocontrol set comes in 3 steps. First of all, as we said, we do have an action for the peel in case of melasma or hyperpigmentation. However, this will only help in superficial layers. This is why we find a second item in our set, which is the depigment mesococktail. So in this case, we will peel, we will pave the way for the mesococktail to be better absorbed, and at the same time we will use microneedling in order to enhance the penetration of the active ingredients into the layers of the skin. And last, of course, we have the depigment cream SPF 50, because as Joanna said, sunscreen prevention is the best way to cure melasma and hyperpigmentation. So now we will, if we sum up what directions of action of the pigmenting substances we should pay attention to, we get a comprehensive plan for combating hyperpigmentation. First of all, what do I need to do? First of all, I need to break this pathway. This is why I have to target the tyrosinase, which is the enzyme that is stimulating the melanocytes to produce more melanin. This is why we will see in our set one of the main ingredients that will help us in inhibition of tyrosinase activity. Second, we want to inhibit the melanosome migration from melanocytes to keratinocytes. 3, we want to do is a very light exfoliation of the epidermis to remove the excessive melanin that is superficial. And what is important when we use peels and acid peels, that when we acidify the environment, there will be deactivation also of tyrosinase. So, what do we see after melanocontrol? After melanocontrol, if we are targeting deep melasma or hyperpigmentation, we will see gradual improvement, and also we can use melanocontrol to give a healthy glow for the skin. So it can be a treatment just to give a glow for the skin, and it can be a treatment that is beyond only glow. Here it's important for me to talk about many treatments and modalities for melasma. When it comes to melasma, most products that we find in the market are products that are harsh peeling. People think that if I have a pigmentation, I have to be very harsh on it and to be able to remove it. However, the opposite is true. Whenever we have a pigmentation, we have to be very gentle to prevent that this pigmentation becomes worse. This is why when comparing a little bit between all technologies of even cold peel systems, we find that we can find immediate result, but not on all types of melasma, mostly on superficial ones. However, we have a high recurrence rate. The melasma or the hyperpigmentation comes again, and we don't know why. So this is why a set like melanocontrol is very important in order to be able to treat the melasma and hyperpigmentation gradually and to have a long-term effect. Okay? So if we do a comparison, we see that when we talk about recovery, melanocontrol is a treatment that has a minimal recovery time. I can do melanocontrol today and go to work. When I do other types of peeling, I have a downtime, I have to stay at home, and I have this peeling effect, erythema. The patient feels that they want to scratch their skin. And with melanocontrol, we have a lower skin irritation risk. Both or any type of melasma treatment or hyperpigmentation treatment requires a home care routine. The home care routine, even with the new melasma and hyperpigmentation treatments, we have home care routine. So it's the same. However, when it comes to melanocontrol, it's more gentle. It's only 2 steps, a cream in the morning, a cream in the evening, and that's it. Okay, let's go more into deep into what we have in the melanocontrol set. First of all, as we said, we have the depigment peel mask. The depigment peel mask will help us in reducing hyperpigmentation, and it will help in brightening. This is why even if I'm not treating melasma, I can use the depigment peel mask as a prepping step for other treatments like microneedling. What does it contain? It has a big amount of, a big number of acids in it. We start with the mandelic acid, which does a gentle depigmentation and a gentle exfoliation. Again, it is very important to note that whenever we are treating hyperpigmentation, we have to be gentle in order to get good results without recurrence rate, and in order for the pigmentation not to become worse, because we have plenty of cases where the patients went to get a treatment for hyperpigmentation and their hyperpigmentation became worse. So when we talk about mandelic acid is a very effective moisturizer as well. The gold standard for hyperpigmentation is alpha-arbutin. So alpha-arbutin is the breakdown product of hydroquinone. So in the past, we used to use hydroquinone for melasma, but it has multiple side effects and it has been banned in a lot of countries. So this is why instead of hydroquinone, nowadays we use alpha-arbutin. And alpha-arbutin is known that it is the gold standard depigmentation ingredient because it helps in inhibiting the activity of tyrosinase, which is the enzyme responsible for stimulating the melanocytes to produce more melanin. The second tyrosinase inhibitor that we have is the exyl resorcinol. The exyl resorcinol will will interfere in the melanogenesis and will reduce the the oxidation. Then we have the salicylic acid. Why do we need the salicylic acid in a treatment that is not intended, for example, for acne? Because salicylic acid is a beta-hydroxy acid. Beta-hydroxy acids are lipophilic acids. So it will help, it has a keratolytic effect. It will dissolve the sebum, and this will make the peel and the active ingredients penetrate better into the skin. We did the peel. The second step is our depigment mesococktail. It's worth saying that whenever we are treating melasma, we are not supposed to inject the mesococktail in the lesions or in the hyperpigmented lesions that we have. The active ingredients work better when we are working with the microneedling technique. The pH of this mesococktail is around 5.5 to 6.5, and this pH is appropriate for the niacinamide that we find in this mesococktail to be activated. What does it contain? It contains ascorbic acid. Ascorbic acid is also gold standard. So whenever I ask someone, what do you do for glow? I use vitamin C. So vitamin C is a gold standard in antioxidation. Definitely we need in this case niacinamide, which will help in, because we really want to have a healthy skin barrier and a strong skin barrier whenever we are working on pigmentation. Also, we have retinyl palmitate, which will help in the cellular turnover. Sodium hyaluronate, glutathione. Glutathione is known as a depigmenting agent. However, I want to ask everyone who's watching today, how many times did you inject glutathione in pigmentations and felt no result. Glutathione will help the vitamin C, will help the ascorbic acid. These products have to be combined together to be bioavailable together. So this is why injecting glutathione doesn't have really an effect. However, when it is used with other ingredients, like ascorbic acid, this will help in modulating the melanogenesis, and it will protect, of course, against oxidative damage. The third step and the last step is the cream SPF 50+. The cream SPF 50+, as its name shows, it's SPF 50. However, this is not only an SPF. This cream, we can find it also in home care products that we will see in a bit, in the day cream. However, this is to continue the treatment. It's not used, it doesn't have to be used only as SPF. This is an SPF that is specifically made for people with hyperpigmentation, because actually it contains active ingredients like auxiliary orcinol, mulberry extract, licorice root extract, vitamin E, and lastly, UV filters, because like we said, whenever we are talking about hyperpigmentation, we have to protect, we have to prevent, okay? Then we will go through the treatment protocol a little bit. Okay, so what are the indications? We can work with melanocontrol on all types of skin affected with hyperpigmentation. People who doesn't have who have an uneven skin tone and dull skin, as we said, this will help in giving the glow. So what do we want to do? We want to reduce the discoloration. We want the discoloration to erode. We need to make it to induce the erosion system in the skin, and also we want to inhibit the melanogenesis. How many sessions will I need? This is the most question that we get in clinics. Actually, what I do is that I ask the patient, for how many years did you have your hyperpigmentation? If you had hyperpigmentation for 5 years, we cannot remove hyperpigmentation in one day. So 5 years need at least 5 other years to get rid of hyperpigmentation. However, I will be gentle with you, I will be good with you, and instead of 5 years, I'm gonna tell you it's 1 year. So when it comes to hyperpigmentation, the patient has to be patient to get really good results, and without recurrence. The patient has to comply with the guidelines that we give. So, to summarize it, usually we recommend an intensive brightening treatment consisting of a series of 5 to 8 treatments. At a 14 days break between sessions. However, if some patients, we usually assess if the patient hasn't healed completely, or we went too deep with the peeling, according to the case that we are working on, we can give that a 21 days duration between sessions. Of course, the patient, as I always say, protocols and treatments in clinic have to be combined with an appropriate home care routine. This will boost that, and they don't work without each other. So, but for this we have only 2 products. It's a day cream and a night cream that we will see later on. We will go through also the ingredients of the day cream and the night cream. Now we will have a look at the treatment itself, how it's done. So first we have the depigment peel mask. Usually we need to put a little bit of water in order to be able to spread the mask correctly on the skin. So we don't need a big amount. One jar can be enough for example, two treatments if we're treating the face, or if we're treating face, neck, and décolleté, we will need the full jar. Procedure in clinic, it has to be continued at home with the home care products. We need to massage it for about 5 minutes in order to the skin. Move it. At this stage, the patient will feel a little bit of tingling. Then we will use the meso cocktail, where we find alpha-arbutin, etc. We can use the meso cocktail in 2 ways. We can massage it into the skin, topical application, or with microneedling. For me, of course, I prefer it with microneedling. However, when we are dealing with post-inflammatory hyperpigmentation, I would skip microneedling for the first 2 sessions. Then on the 3rd session, I will start with microneedling. Because when we have post-inflammatory hyperpigmentation, we have to work more on the inflammation hyperpigmentation pathway. The 3rd step before the patient leaves the clinic is the SPF. That also, as we said, contains active ingredients like exilresorcinol, etc. It's not only UV filter. Okay. Now, as we said about home care products are complementary for the treatment. We cannot do the treatment without having an appropriate home care routine. And it's only 2 products, because we know that people with hyperpigmentation, they are with this problem because they skipped a lot of skincare routine in the past. So in Purlé, we simplified the home care routine for it's only 2 steps. Okay, so we have the day cream 173 and the night cream 174, and now we will see more what are really the ingredients that work. As we see here, we have the exilresorcinol 1%, licorice root extract, mulberry extract, vitamin E, and UV filters. This type of cream will help in protecting against UVB and UVA, reduce dark spots, etc. But I would like to highlight the importance of exilresorcinol. Why do we have exilresorcinol? Because exilresorcinol is a brightening and anti-aging ingredient, but also it inhibits tyrosinase and breaks down existing melanin. So our 2 goals are inhibiting tyrosinase in order not to have more production of melanin, and of course we want to break down the existing melanin that causes the hyperpigmentation itself. This is why also this product, even when we're done with the treatment, this product is a good maintenance product for people who suffer from hyperpigmentation, because like Joanna already mentioned before, there are a lot of intrinsic factors when it comes to hyperpigmentation, like hormones. This is why we see it in women more than men. So exilresorcinol will help us in inhibiting the process and getting more hyperpigmentation in the future. And the licorice root extract has a very strong anti-inflammatory and soothing properties. So this also will inhibit the pathway of inflammation, hyperpigmentation. The second active cream is the depigment night cream. In the depigment night cream, we find glycolic acid 5%, we find tranexamic acid. Tranexamic acid is the best when it comes to hyperpigmentation. Usually in clinic, whenever we have a post-inflammatory hyperpigmentation, one of the treatments that we use is injecting tranexamic acid. Sometimes also we give tablets of tranexamic acid. So we can find it in the 174 depigment cream, and this will help in inhibiting as well the tyrosinase activity. Also, we have exyl resorcinol that is common with the 173 in day cream and licorice root extract. Now, with Joanna, we'll see some before and after results that are quantitative. When it comes to Purlay, nowadays we don't say that it improved. We have a proof that this pigmentation improved. Thank you, Joanna.
All right, so we have a few photos of before and after on our clients from the LumiScan Pro by Purlay. This is after one treatment without microneedling, and the second and the third treatment was already with a microneedling. So the skin here was quite thin, was dry, was quite sensitive. And here we had treatment every 14 days. And of course, each of our clients is going to use the home care, so 173 and 174. You can see the difference. The pigmentation, it's really less. The skin is brighter. The pores are not enlarged anymore. The skin looks much better. The color of the skin looks much better. Here under the UV light, if you're going to ask me when was it and how do I know that it's not photoshopped, or how can I know that this is the results after 2 weeks, for example. So up in the photos you have the date and the time. So this is the same patients with one treatment without microneedling plus 2 treatments with microneedling. We can definitely see the difference. There's no so many brown spots. The skin is brighter and again looks much better. So here on top of the photos we have the different types of the light from LumiScan Pro by Purlay, which I was talking about in the very beginning. So we have the UV light, cross-polarized light, natural light, and parallel light. And again the same patients in, as you can see on top of the photo. Much improving. One treatment without microneedling, and second and the third one with microneedling. And then again from different sides, the same patient under the UV light. You can see, for example, on the chin, the difference.
That's impressive. Where do you see the difference?
Yeah, look at here. There was some post-inflammatory erythema, post-inflammatory hyperpigmentation. So after almost a month, the clients had half of the pigmentation left.
That's 2 or 3 treatment maximum.
3 treatments, yeah. Here we use the melanocontrol system without microneedling. This is after 1 treatment, but this patient, she was using 173 and 174, so our home care products. As you can see, post-inflammatory erythema, as we can see in the first picture, there was a few spots there, but there was also inflammation. We have comedones here, and after using the home care, the skin regenerate, looks much better. There is no PIE anymore. So it's not only for hyperpigmentation, but also for younger skin, for example, with acne, with comedones, with some minor inflammation because of the ingredients from the products. So the second picture was taken on the second day, in which it can be observed that the treatment with acid caused a strong darkening of the discoloration. Because after using melanocontrol system, we can see that the skin gets darker and then, of course, starts to peel. Photo number 3 was taken 4 days after the procedure, and the last photo was taken after 1 week after the procedure. So we can actually see the definite difference here on this photo. The discoloration is definitely less visible. The skin is brighter, and this is actually only after 1 treatment. The procedure was performed here without microneedling mesotherapy, and of course we recommend the clients the appropriate home care routine, so 173 and 174. Another patient after melanocontrol system. Here we had just with microneedling. And we recommended the home care, the SPF cream and depigmenting night cream. And also this patient had very dry skin, so we also recommend cream 162, the microbiome spectrum. Do you have any questions? No questions? Everything is clear? Very good. So, thank you very much for today.
Thank you.
Together with Jessica.
usually it's great because we get to meet new doctors, new friends,
to connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
usually it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.
Usually it's great because we get to meet new doctors, new friends.
To connect with colleagues and to stay up to date with all the innovation.
Advanced, very regenerative solution.
We use not just one single exosome, we use two.
In Paris, we meet a lot of doctors and clinics.
Here in IMCAS, one of the famous congresses in the world.
Jesteśmy bardzo podekscytowane, świetnie nam poszło.